News 3 starts right now.
We've given out 7 million Johnson & Johnson vaccines in the United States roughly to date, and we have 6 cases. So we're talking about 1 in a million.
And tonight we know one of those cases is a woman here in Nevada, an 18-year-old hit with a serious blood clot after she got the J&J COVID vaccine. Good evening, everyone. Glad you're with us tonight. I'm Jim Snyder.
And I'm Marie Mortera. As the CDC continues its pause of the Johnson & Johnson vaccine following concerns of rare blood clots, Nevada doctors are treating one woman with a serious reaction. News 3's Lauren Clark explains what we know about her so far.
Well, officials haven't confirmed where she lives in Nevada, but CDC data says she didn't have any known underlying health conditions, and she's still recovering tonight in the hospital.
It's very, very rare.
As a city based on odds, we can appreciate the metaphor.
We've given out 7 million Johnson & Johnson vaccines in the United States roughly to date, and we have 6 cases. So we're talking about 1 in a million.
Dr. Christina Madison with Roseman University says not much is known about these extreme side effects, including if the blood clots and vaccine have a correlation at all.
They may have had this blood clot independently of the vaccine. It just happens that they happen to have the vaccine right before they got the blood clot. So we don't know yet.
Still, with a total of 6 adverse reaction of blood clots across the country, the CDC paused the rollout in abundance of caution. One of those cases happening here in Nevada. Per CDC data, an 18-year-old woman started experiencing a clot 14 days after her shot. The clot, occurring in the veins that drain the blood from the brain, was surgically removed.
There's so many things we do in taking medications, seeing our doctors for procedures that have much more higher risk, and we easily walk into those situations.
While these rare cases might be frightening, Dr. Jonathan Baktari, CEO of E7 Health, puts it this way. Statistically, there's a higher risk of getting a blood clot via birth control, pregnancy, smoking, and even COVID-19 itself.
If you are hospitalized with COVID-19, you have a 1 in 5 chance of having a blood clot. You know, in the grand scheme of things, those odds are pretty good when you look at the benefits of getting vaccinated and preventing hospitalization and death.
So what should you do if you got the Johnson & Johnson vaccine recently? Well, doctors say, first of all, don't panic. This is extremely rare. But look out for these symptoms 6 to 14 days after you get the vaccine. That includes headache, abdominal and leg pain, shortness of breath. If this is happening, make sure to see your doctor.
Lauren, do we have any idea why this may be happening?
Well, again, doctors still don't know if there truly is a cause with the vaccine and the blood clots, but they do have one theory if that's the case. Similar to the AstraZeneca vaccine that uses similar technology, doctors think it might be triggering an antibody response that could be causing those blood platelets to clot. Marie?
Lauren, thank you.